I think this is really important for Americans to understand. We talk about socialized medicine, Medicare for all. You can look into the UK, you can look into Canada where they have those systems. They manage cost very differently than the United States. So I want to explain the two models. In the United States, when you have insurance and you have a PPO, the Affordable Care Act requires all these plans that cover everything on an unlimited basis. And so what you have is essentially an unlimited buffet of healthcare services that can be available. I think that's a good thing. I think people need to have access to care. It needs to be affordable. Healthcare is a right. I believe we should do that and support our citizenry because people need access to medications. They need access to healthcare. But there's two ways to look at this. Insurance companies, when they think, okay, there's an unlimited risk here, we have to find a way to manage the cost and be you would like them to be good stewards, but they manage the flow of medications and procedures based on how they can make money, right? If you contrast that to what happens in Canada or the United Kingdom, they have a budget that they set of what they're going to pay for healthcare in a given year. And this is why you find people in those countries, when they need a hip replacement, when they need an elective surgery, they're not getting it in 2 weeks or a month. Sometimes people will wait 6 months, a year, 2 years to have a procedure. Or you end up in a situation where you're elderly and the government has to make a determination, is it worth giving this person a kidney transplant or is it worth paying to have this person's hip replaced? Nope, we need to save those dollars to pay for somebody else. That's where the whole death panel thing came up when the Affordable Care Act was being passed. There was this fear that there was going to be death panels. It's also why in those countries you see a thriving private insurance market, which is counterintuitive because they have socialized medicine. What are people buying private insurance for when the government pays for it all? They're paying for priority and they're paying for access for things that the traditional social medicine system isn't going to cover. And it's also why you see medical tourism from Canada and from other countries coming to the United States because they can get in and get seen and get their treatment done, where in their home country, they're not able to.